To test stereognosis, or object identification, place a familiar object in the patient's hand. Ask him to identify it.
It's a key.
Repeat the procedure on the other hand using a different object.
It's another object. It's a button.
To test number identification, or graphesthesia, use a blunt object to draw a large number on the palm using a single continuous stroke.
7.
The number should face the patient, not the examiner. Test one palm, then the other.
9.
2-point discrimination is tested by asking the patient if he's been touched in one or two areas.
Sure.
Using two ends of an opened paper clip or the sides of two pins,
1.
repeatedly touch the patient's finger pad with the 2 points at the same time and with 1 point occasionally. Ask
1.
the patient to identify if he's being touched with 1 or 2 points. Then reduce the distance between the points so that you can determine the minimum distance at which the
1.
patient can identify 2 points. On the finger pad, the distance should be less than 5 millimeters. To test point localization, touch a point on the patient's skin.
Here.
Then ask him to open his eyes and point to the place touched. This test is especially helpful on the trunk and legs.
Here.
To test extinction, simultaneously stimulate corresponding areas on both sides of the body. Then ask the patient to point to where he was touched. Normally, he should feel the sensation in both areas.
Here and here.